Hello and welcome to the Mid-Range Theory presentation on Roberta Mercer's maternal role attainment and Kristen Swanson's theory of caring.
The majority of Mercer's background and credentials is in maternal child nursing and family health nursing. She focuses on new moms, mothers with infants with birth defects, teenage moms, and then the maternal role and the family relationships. This is considered a mid-range theory because it focuses on the specific population of mothers, children, infants specifically, and the family, the health condition of the client in the area of practice. Her mentor, Reva Rubin, is where she gets the vast majority of her theory from, and she expands on much of Rubin's theories. This is considered empirical evidence used by the variables in research of the mother, infant, and father. She employed her research and other sources to guide her own research. She used many variables for measurement, including factors of the environment, such as illness, stress, and the relationship between family members in her research. In Mercer's nursing meta-paradigm, the nurse is responsible for promoting health of the family. The nurse provides important care and education during pregnancy and the first year of life. The person is not specifically defined in Mercer's meta-paradigm. However, she does discuss the maternal role most, how the self is separate from the roles that the mother plays. The mother may regain herself, and her self-esteem is important in the attainment of the maternal role. Health of the mother and father, their perception of their health also plays a big role, including their health outlook, their big concerns, how they feel about sickness, and if they reject their role as parents. The environment, her meta paradigm for that is the development of the person cannot be considered apart from the environment, and stress and social support influence maternal and paternal and child development. The major assumptions are a stable core determines how the mother will define events and how she'll respond to the perceptions of others. That is also determined by social interactions, development level, and personality. The infant's growth and development will reflect the mother's role competence. The infant is considered an active partner in the role-taking process, and the significant other also contributes to the role attainment, and this role can't be duplicated by anyone else. There are several major concepts that Mercer focused on. However, the biggest focus was on maternal attainment and identity, which focuses on how the mother interacts with her baby, her personal views of herself as a mother, including her self-esteem and how others' opinions of hers are. Mercer includes in this the gratification a mother feels in her role and attachment with the baby. She also discusses mental health, such as anxiety, depression, and stress. Included on the major concepts is social support from the family and the relationship with the father, which sets the tone for the environment the baby is raised in, and all these will affect how the mother will function in her new role as mom. The theoretical assertions, Mercer proposed changing the name from maternal role attainment to becoming a mother because it's an ever-evolving role. The microsystem is just the immediate family, mom, dad, baby, any siblings. The mesosystem includes outside places frequented by the family, such as daycare, church. The macrosystem includes the social, culture, political roles, political norms of the microsystem, and these stages are ever evolving and overlapping.
Mercer's schematic is divided into three separate systems that all interact with each other and ultimately influence the ultimate goal of maternal role attainment. The schematic has three layers. The innermost layer is microsystem, the middle layer is called the mesosystem, and the outermost layer is the macrosystem. The macrosystem refers to the cultural beliefs and practices in the society where the mother lives. So this could include things like the healthcare system of that society or the laws in that society that relate to mother and children. The middle layer is the mesosystem. This includes outside influences that interact and influence the people in the microsystem. So this could be daycare, the child's school, the parent's work environment, the church the family attends, or any other similar institutions that are in the mother's immediate community that can have an effect on her, her child, and her family. The innermost layer of the schematic is called the microsystem, and this is the most influential and important of the three. This includes things and people in the mother's immediate environment. So some examples of the things that are included in this layer would be the family's functioning, the stressors the mother might endure during this transition, the mother-father relationship, social support that the mother feels, and the two main portions of the microsystem are obviously the mother and the child.
So Mercer used both deductive and inductive logic in developing the theoretical framework for studying factors that influence maternal role attainment during the first year of motherhood. Deductive logic is demonstrated in Mercer's use of works from other researchers and disciplines. Mercer also used inductive logic in the development of her theory of maternal role attainment. Through practice and research, she observed an adaptation to motherhood from a variety of different circumstances. She noticed that differences existed in adaptation to motherhood when maternal illness complicated the postpartum period, when a child with a defect was born, and when a teenager became a mother. Many of the current concepts in maternal child nursing are based on Mercer's research. The theory of maternal role attainment is credited with enhancing understanding and making Mercer's contribution extremely valuable to nursing education. This theory provides a framework for students as they learn to plan and provide care for patients in a variety of settings. Mercer's research has also been shown to be helpful to students in other disciplines, such as psychology, sociology, and education. Mercer's research in the 1970s led to the development of a reliable instrument to measure mothers' attitudes about the labor and delivery experience. Other researchers have also used her framework for exploring differences between mothers of different age groups. Both the theory and model are capable of serving as a framework for assessment and planning, implementing, and evaluating nursing care of new mothers and their infants.
Swanson's theory of caring was developed after she attended a miscarriage seminar where a doctor only focused on the pathophysiology of the miscarriage, when she noted that women wanted to talk about their experience and their feelings. The majority of her research focuses on mothers who have miscarried, but her research and theory extends to everyone. As outlined on the slide, Swanson's major assumptions are specific to the four phenomena of the meta paradigm: nursing, person, health, and environment. Swanson's theory of caring major concepts are caring, knowing, being with, doing for, enabling, and maintaining belief. The theoretical assertions are that good nursing is caring for a client's entire well-being, caring is basic to human beings, and caring is delivered according to the nurse's own attitude, understanding, and actions towards the client.
Swanson's schematic for the theory of caring is organized in more of a linear fashion, and it shows all of the parts of the nurse that must be there in order to adequately care for your patient and ultimately get to the intended outcome of their overall well-being. The first portion is consisting of maintaining belief and knowing. Maintaining belief just says that the nurse is consistently believing in the person to be capable of getting through whatever event they're going through. You always review them as respectable and valuable. You maintain an optimistic view, always supportive, and you want to help them find meaning, which leads into the second part labeled knowing. This is consistently attempting to understand the meaning of this person's situation through their eyes. So you want to focus on your assessment, but you want to use their views, involve them, look at their cues, avoid any exceptions in helping them figure out what the meaning of this situation is. The next portion is divided into being with, doing for, and enabling. Being with, again, is the nurse showing the person that they are emotionally present. You want to assure them and prove that you are available, and this is also a time that you can share your feelings and experiences with them in a helpful, selfless way. Doing for is the golden rule of treating others how you want to be treated. So you want to advocate and protect that person, comfort them, anticipate their needs, and this is where you perform therapeutic actions that are individualized for this person in this situation. The last part is enabling. You want to help them handle the situation, offer any informed explanations, think it through with them, give them feedback and recommendations, and again, as always, validate and support them. So all of these things are included in caring for a patient in order to get to their well-being.
Now Swanson's logical form. Swanson's theory of caring was developed using an inductive approach. It was generated from phenomenological investigations with women who experienced unexpected pregnancy loss, as well as caregivers of premature and ill babies in the NICU, and socially at-risk mothers who received long-term care. Swanson claims that her in-depth meta-analysis of research on caring has supported the generality of her theory beyond a perinatal context. Swanson's work on caring and miscarriage has been cited or otherwise used in more than 190 data-based publications. Examples of applications of Swanson's theory of caring in clinical practice include exploring clinical scholarship in practice, guidelines for nurses working with patients diagnosed with multiple sclerosis, assessing the effects of caring in work with vulnerable populations, the importance of creating a caring environment for older adults, study of lesbian couples who miscarry, and the research of children who sustained traumatic brain injuries. Nurse caring recognizes the importance for nurses to attend to the wholeness of humans in their everyday lives. So, Swanson's theory offers nurse educators a simple way of initiating students into the profession by immersing them in the language of what it means to be caring and cared for. Nurse caring is manifested in different ways and many different contexts.
For our hypothetical scenario, we have a nurse practitioner named Sally that specializes in addiction and drug treatment. She has extensive education and knows of various treatment options for her clients. She originally chose to work in this field after her best friend overdosed after struggling with addiction for years. She currently works for a voluntary drug rehabilitation facility, and utilizing the theory of caring, Sally is able to perform her duties daily and has developed a deep understanding and sense of pride related to helping others and watching their lives flourish with their newfound strength and sobriety. She acknowledges her own pain and healing from the loss of her dear friend, but practicing yoga daily, meditating, and attends monthly counseling sessions for herself. The nurse practitioner understands that applying the theory of caring to her practice enhances her care and helps to facilitate the intended outcome of her clients that she cares for. She understands the four main phenomena of concerns to the nursing discipline: nursing, personal client, health, and environment. She uses her nursing knowledge to provide informed care. She has strong understanding that all people are unique and each have their own story, and she respects them for that. For the case study provided, the theory we feel most appropriate for Mr. K's case is Swanson's theory of caring, as it hits the major concepts and definitions of this theory, such as caring, knowing, being with, doing for, enabling, and maintaining belief. The nurse practitioner cares enough to be emotionally present and to spend a lengthy amount of time with the patient discussing his life and finding out what's going on with him.
In summary, both Mercer and Swanson developed theories based on their experience and research in the perinatal setting. Mercer focused on women and the changes they go through as they grow into the role of motherhood. It can be applied to help facilitate maternal coping and family functioning through this stressful transition. On the other hand, Swanson focused on the need for caring during the transition to a new stage of life. Her theory is applied through being with and doing for patients in order to support them through this transition to a new stage of life while maintaining faith that they can get through whatever challenges they are faced with. While both of these theories can be applied outside of their context, Swanson's theory of caring is more universal and easily applicable to all nursing settings.